This is a really hot topic in the parent community. Hi everybody, welcome back to Kim's channel. My name is Michelle. I'm a registered dietitian practicing in Toronto, Canada. I'm the owner of the Family Table Nutrition Services. I'm here taking over Kim's channel today to talk to you about baby-led weaning. This is a really hot topic in the parent community and something that our dietitians who work in community settings and public health settings probably get a lot of questions about. Now, it's important for dietitians who do work in those areas of practice where parents are asking about starting solids with their babies to know a little bit more about baby-led weaning. So it's really important for us to know the risks, the benefits, and how we can better support parents in starting baby-led weaning. Baby-led weaning, or BLW, is basically a philosophy around starting solid foods. A lot of people think that baby-led weaning simply means offering finger foods instead of purees, and certainly that is part of it. We'll talk about that in a little bit, but it's also just the philosophy of allowing baby to take control over their feeding experience. We're enabling babies to listen to their hunger and satiety cues, to decide what they want to eat, how much they want to eat, decide the pace. It's all about their experience. It's very sensory for them as well. They get to touch, to taste, to lick, to smell, to really fully engage in the eating experience. Compare that to the pureed experience, where somebody else is controlling what food you're going to eat, someone else is controlling the pace that you're going to eat it at, and they might resort to unexpected bites and sneaky tricks to sneak a spoon into your mouth when you're not paying attention. Everything kind of tastes the same, as opposed to baby-led weaning with lots of different textures, lots of different flavors, and a variety of foods. With baby-led weaning, babies are eating the same meals, more or less, as the rest of the family, with some baby-safe modifications, as opposed to puree feeding, where somebody else is feeding you something that looks a lot different than what the rest of the family is eating. Now, parents are choosing baby-led weaning for a number of reasons. For one, it's a lot easier and a lot faster to get dinner on the table when you don't have to make separate meals for baby. There's no extra cost to buying baby food jars and pouches. There's no extra time having to spend with blending things up and freezing little containers. Everything is just the same food with a couple of little modifications to make it safe for baby. One of the best things about baby-led weaning myself as a mom, when I started baby-led weaning with my own daughter, was I actually got to sit down and eat a hot meal with her. If you've ever had a child, you know that that is a luxury. Baby-led weaning is also very much in line with Ellen Satter's division of responsibility. And this is a tool that we do teach a lot to parents who complain about picky kids and about mealtime drama. We often recommend to follow Ellen Satter's philosophy around feeding, which indicates that parents are responsible for what they're going to eat, when they're going to eat it, and where they're going to eat it, and allowing children to be responsible for everything else. Which foods they're going to eat, how much they're going to eat, and really whether or not they're going to eat it at all. Baby-led weaning very much follows the same philosophy, and Ellen Satter's philosophies are very much based in evidence, which makes baby-led weaning all the more appealing. Now, it has been proposed that baby-led weaning may also have some physiological and psychological benefit too, though it's not totally understood yet in the research. It's still ongoing. We believe that because babies are in full control of picking foods up and bringing it to their mouth right from the very first bites, and responsible for chewing and masticating food around in their mouth as opposed to puree feeding, where everything is already kind of done for them, that this might help to develop oral and motor muscle skills even faster than those who are fed with purees. And because babies are being exposed to such a big variety of flavors, textures, and different foods right from the very beginning, it's thought that this might help to reduce the risk of picky eating, or at least reduce the incidence of picky eating later on in childhood. Picky eating is a normal part of toddlerhood, part of asserting independence and control, but it's thought that it might at least help to reduce the severity of that pickiness when they get into toddlerhood. As clinicians, we have the responsibility to make sure that our clients are making informed decisions. That is, that they understand fully what our nutrition care plans entail, the risks, the benefits, and how we can support them. For families with young babies, this is a very vulnerable population. We need to make sure that we have the information that will help to support them and enable them to follow baby-led weaning safely, which can be a big concern. Although there is some risk involved with baby-led weaning, we'll get into that in a second, there's also a very large growing body of evidence in support of baby-led weaning. So it is something appropriate to talk to your clients about if they're interested in baby-led weaning, but they do need to know how to do it safely. So first, let's talk about the recommendations for starting solids at all. We want to make sure that babies are developmentally ready to start solid foods. That means that they have the trunk support to be able to sit upright, which is a mechanism protective against choking. We want them to be able to pick up objects from the floor and bring them with precision to their mouth. Think about any baby who's brought their toys to their mouth or chewing on teething rings, that sort of thing. We also want them to be interested in food, and that's a really big component. A lot of parents say that, oh, my baby's interested in food, he's 3 months old, I should start to give him solid foods. But if they're not developmentally ready in the other ways, then they're not quite ready for solid food. A lot of parents will ask, well, my baby doesn't have any teeth yet. Does that mean that I have to hold off on giving them solid foods? And absolutely not. Some babies are actually born with teeth. That doesn't make them ready for solid food. Some babies don't get teeth until they're well over a year old. They're ready for solid foods prior to that. As dietitians, we know that clients with dysphagia and other oral muscle issues and other dentition issues can actually manage pretty large variety of textures even with no teeth. And if you have a baby and you've ever been bitten by a baby with no teeth, you know those gums are still pretty strong. Now, the main concern that people have about baby-led weaning is always choking. People are very concerned that if I give my baby something other than purees, they are going to choke. I think, well, I have to give my baby puree. They don't know how to swallow yet. How can I possibly offer them a finger of toast or a strip of omelet? The fact of the matter is that babies know how to swallow right from the very beginning. For most healthy babies, that is. They've been suckling at the mother's breast or from a bottle right from the very beginning. They know how to do that and how to swallow. They know what pace that they want to feed at. They know how to listen to their start and stop cues. Somehow around 6 months of age, we decide that they don't know how to do that anymore and that we have to be the ones in control. And really, they have that mechanism there all along. They just need the support and the appropriate environment to be able to do it all by themselves. Now, certainly there are some foods that are off limits for baby-led weaning, as well as puree feeding for that matter for choking risk foods. We'll get to those in a minute. But for the most part, babies can eat pretty well the same meals as the rest of the family with a few modifications. Ideally, we want babies to be able to eat soft, solid foods. So think of foods that you might be able to mash between the index and thumb of your own fingers, or that you can squish against the roof of your mouth. That would be the appropriate texture. In terms of shape and size, about the size of an adult pinky finger is perfect. Think of roasted sweet potatoes, strips of omelet, strips of toast, things like that. That would be the appropriate texture. Things with built-in handles also work very well. Steamed or roasted broccoli, chicken drumsticks with that little pointy bone taken out, ribs that are nice and soft cooked, all very appropriate foods for babies. By offering foods in the appropriate environment, allowing baby to sit upright at 90 degrees, well supported, they're being supervised well by a parent, minimize the distractions so that they can focus on what they're doing, and offer foods that are those appropriate shapes and sizes and textures, we can very much reduce the risk of choking. The research has shown that there is no actual evidence saying that baby-led weaning babies are at increased risk of choking. If anything, the research is actually showing the opposite. There were 2 studies in 2017 done on baby-led weaning babies and choking. The first found no evidence of increased risk of choking for baby-led weaning babies. The second found that the risk of ever choking was actually less in babies who had been fed with baby-led weaning, meaning that those puree and sometimes chunkier puree-fed babies were actually at greater risk of choking when they were introduced to solid foods. Now, baby-led weaning is not right for every baby. There are some conditions that actually do increase the risk of choking, and these babies might not be so appropriate for baby-led weaning. These are babies who have developmental delays, hypotonic babies, babies who have cleft lip or cleft palates, and also preemies. We need to wait until they are developmentally ready, meaning we have to wait for adjusted age before they're ready to start solid foods. These are all things that may increase the risk of choking, and therefore they might not be right for baby-led weaning, and that's okay. It's also important to think about the environment that baby is eating in. We want to make sure that baby is sitting fully upright with trunk support, because that's actually very protective against choking and protecting the airway. We want to minimize the distractions and always, always, always encourage parents to sit with their babies to supervise, because should anything go wrong, you want to make sure that parents are there to intervene. I should mention as well that with my clients, I encourage everybody to take an infant CPR course, regardless of whether they're doing baby-led weaning, purees, a combination of the two. For parents, grandparents, babysitters, nannies, anybody who's going to be involved in feeding a baby, they need to be educated just in case something did go wrong, because you wouldn't want something to happen and the person who's supervising the baby to not have the skills to know what's happening and how to intervene if intervention is even necessary. One of the actual biggest risks of choking is when people intervene too soon. There's a difference between gagging and choking. When babies are gagging, they're making noise, they might be coughing, looking a little red in the face, but they can usually cough it back up themselves and be perfectly okay. There might be a little bit of vomit afterward. That sometimes happens. If they're choking, that's something that does require immediate intervention. That's when baby is not making any noise or very little noise. They're becoming very distressed and possibly even turning blue. Intervention is required. There is a difference between the two, and parents need to know what that difference is, because usually they hear their baby go, and they say, they're choking, I have to stop. It's simply not the case. Gagging is normal and gagging is expected. Choking is not something that's supposed to happen.